I'm Dr. O.H. Frazier. I'm at the Texas Heart Institute in Houston. I'm the Director of Cardiopulmonary Transplantation and Mechanical Circulatory Support at St. Luke's Hospital. I've known this whole field has, very few people involved. The HeartMate 2 started when let me say this. Rob, I've known Jarvick since the 70s. And as I said, this is a very small field. In the 70s, I could have put around a small conference table all the physicians that had any interest or involvement in the field. Now, of course, I had a course at the STS last week that I was in charge of, and it was sold out. And these are just the regular cardiac surgeons, they're not people in research or academics. So it's clearly going into the mainstream now. But Rob began working on this, and I began working on this together in 1986. And Rob is a lot of things. He's pretty good on TV, it looks like. He's a pretty good actor, and but he's also a very good machinist. He would actually make these pumps in his apartment in New York, which I'm not sure wasn't violating some code of some sort, send them down to me, and I would implant them and then send them back when they failed. And the thing he did that was a great contribution is he worked out how to have non-lubricated bearings in the bloodstream that to date have shown no wear. None of these Jarvick pumps or the HeartMate 2 have been pumped to failure, and that's an important consideration. Now, as far as being stalled in studies, Rob is a wonderful, talented person, but I don't know, he's run this without any investment capital. It's still Rob and I think about 20 employees. His manufacturing facilities is in Midtown Manhattan, which I'm told is not the ideal place for a manufacturing facility, but he is dealing with the FDA himself. And whereas you have a company like Thoratec with 1,000 employees, with people assigned for these various tasks and marketing, etc., they've got an enormous advantage in their way of interfacing with the FDA. As I mentioned to you, I implanted the first Jarvick pump actually in 1999, and I didn't implant the HeartMate 2, the first HeartMate 2, until November of 2003, and yet it is already basically approved. It's been approved by the panel, and I'm sure will be approved by the FDA soon, whereas Jarvick is still not even close to getting to the panel. And it's not because of the pump per se. I think it's just he doesn't have the wherewithal to address all the FDA issues as well as a company with a lot more resources. Now, I think Rob is working on that, and I still work with him and talk to him nearly daily or certainly weekly. And he has made certain improvements in the pump also. But nonetheless, I think as it will pan out, there may be different patient indications. Certainly the long-term use of the Jarvick has been very good. Once the patients leave the hospital, then by definition it's working more or less in parallel. That is, the native heart is. The early hospital mortality, though, has been high with it, and I think that's where a pump like the HeartMate 2, which leaves a reservoir of blood in the native ventricle, is more forgiving. So particularly in programs that have less experience with these pumps, which, to be a commercial success, it has to get out into the general community hospitals and has to be able to be implemented safely by the routine cardiac surgeon. I think the HeartMate 2 has an advantage in that it is more forgiving in the early postoperative period. Its late complications, however, still need to be addressed, whereas the late complications with the Jarvick have been minimal. We've had really no pump-related deaths with the Jarvick once the patients have left the hospital.